Hi everybody, this is Lisa Adams again, and I'm here to talk to you about the process of getting dentures. And one of the things that most people go through is this step-by-step process, and it starts with an unfortunate visit to a dentist or a prosthodontist who will tell you that your teeth are not salvageable, and then tell you that you need to have all of your teeth extracted. And they'll generally make that determination after they have taken a Panorex x-ray or perhaps even a CT excuse me, of your head and face. And that helps let them look at all the teeth roots and the abscessing and degree of infection and generally the overall health of your teeth. And once the determination is made that your teeth are not going to be salvageable, at that time then you can go ahead and start making or rather preparing yourself for the process of getting dentures. Now, I don't have dentures right now, and I've had all of my teeth extracted, and there's lots of reasons for that for me in my personal story. And I've talked a little bit about it in my other two videos. I was in a car accident with a drunk driver, and I had a lot of trauma to my face, my teeth, and broke all my rear teeth, and broke some part of the upper palate on one side. I also have a gastric resection, which makes absorption difficult, and even without that I had some problems with absorption and have had my entire life. I have microcytic anemia and have difficulty absorbing things like vitamin D and vitamin A and all kinds of different vitamins and calcium, potassium, that mineral base that you need to make the matrix for healthy teeth. In addition to that, after I was in my car accident, I had 10 years of pain management therapy, and I'm still having pain management therapy. And anytime you're on opiate pain medication, you're going to have dental damage. And the reason for that is because all opiates cause the mouth to be dry, and without your mouth staying moist, you will develop periodontal disease. And in addition to that, even if you take great care of your teeth, you see a dentist regularly, the process of being on pain management, or if you're using recreational drugs like people who use methamphetamine or cocaine or take prescription drugs and abuse them, the process will be the same, although greatly accelerated. And you can have just tremendous dental damage rapidly. For me, it was a real long process, and I didn't have great teeth to start with, so there were it was a multifactorial problem for me. I also developed, some problems after my accident with my health that contributed to that. I have a colonization of 3 different bacteria which are very virulent that I developed after having my children with a post-operative infection. And so the bugs that live in me are terribly virulent bugs, and when they have a chance to overgrow, they can be just really devastating. And so they could not treat the infections in my teeth very well, and because I additionally have several allergies to antibiotics, there's really not much I can take anymore. And even with IV therapy, IV antibiotics, the bacteria that were causing my particular abscessing was not responding to drug treatment, and I was on antibiotics for 4 or 5 months, if you can Imagine that. And for me, it just became vastly apparent that I was going to have all of my teeth removed. And that was devastating, I'll be honest with you. I'm 45 years old, and I look like I'm 55 or 60 at the present moment. Now, I will look more like myself after my dentures are made, and my appointment to start, you know, the impressions and the wax workup is for next month on March 15th. I had my extractions done, almost all of them, in December of 2015, all but 4, and then in January I had the remaining 4 pulled, and one of those was a very complicated surgical extraction that just, I had a complication, wound up in the hospital. And although my prosthodontist, Dr. Roger A. Lawton at the Northwest Center for Prosthodontics in Olympia, Washington, is just fantastic. He took terrific care of me, availed himself to me by phone and text. He was away while it happened, unfortunately. He flew out of town right after I had the extraction, and so I was really on my own. It was a scary situation. But for most of you, your extractions will go smoothly. I didn't feel really a thing when I had, you know, the 14 or 16 teeth that I had pulled all at once in December. And, you know, that of course depends on the skill of your dentist or prosthodontist, but most doctors are fairly proficient with extractions. And if you need to be seen by an oral surgeon and you can afford to do that, or your insurance covers that, it's probably a good idea. I don't have dental insurance, so this is something that we've had to pay for completely out of our own pocket, and we really struggle financially. Even though my husband is a physician, he only works part-time and doesn't operate anymore, and although I am a medical professional, I am now disabled as a result of the car accident that I had 10 years ago. So I can't work anymore. I was a cytologist. Those cytologists work in pathology, diagnosing cancer and infectious disease by sitting at a microscope and looking at body fluids and tissue samples and pap smears and all nature of things. And you have to be in a very static, fixed position, and after I broke my neck and back, I just couldn't do that anymore. Especially after I had the reconstructive surgeries that I've had on my neck and back to stabilize my spine. And I have lots of herniations in my back, so even sitting up and standing can be quite challenging for me now 10 years later. I am on chronic pain management regimen, and I have been at times on way too much medication. And I think all chronic pain patients have to come to terms at some point with the fact that you either trade total pain relief and unconsciousness and really a lack of having your life and your mind and your cognition for a lot of pain. And for me, because I had children, it was really important for me to make the choice to deal with the pain, at least a lot of it, rather than deal with, you know, kind of checking out. So what I had to do was just come down on my medication as much as I could possibly stand it. And, you know, it's hard when you're in a lot of pain to live your life, but it's possible. And there are side effects for everything. And one of the side effects for pain management is dental damage. It is for everyone, whether you're taking your medications appropriately or you are abusing prescription drugs recreationally. All of those medications, opiates, benzodiazepines, like muscle relaxants, and many others, cause the mouth to dry out, and you'll develop periodontal disease. So that's kind of the reason I had my condition. But I had my extractions and it went really smoothly, except for just this one tooth that I had serious complications with. And you know, it gave me the opportunity to really see my practitioner in his very best state. You know, he really was worried about me, and he made himself available to me. And if your doctor does not do that, and you have problems, or even if you have a lot of questions and the office isn't there to help you, I suggest that you get a second opinion or a third opinion if necessary, because it's, you know, you want to make sure you get the very best care that you can get. And this is expensive care, make no bones about it. Dental care is incredibly expensive, and very few Americans have more than, if they have dental coverage, it's some minuscule amount, like $1,500 a year or $2,500 a year. And many of you already know that that will cover something like a crown, or, you know, a root canal, and maybe a couple of cleanings a year. Well, for people that have serious dental problems, it's like having nothing. And I have nothing, so, because I'm on Medicare, and Medicare does not cover any dental expenditures, dental surgeries, nothing. You're on your own, which is just madness, right? I mean, Medicare covers old people over 65 and disabled patients like myself. These are the patients with the least amount of money in the entire United States, but you just don't get coverage. That's the way it is. But what we did is we really saved, and we did a lot of fundraising. And I'll do another video about fundraising. You know, right now my fundraising is just terrible. I'm not having anyone, you know, make donations, and I hope that changes, because I'm going to have my own problems if I can't, you know, raise more funds. And one of the things I really wanted to do is do fundraising and see if I could raise enough funds for the treatment that I needed, and then, you know, start raising funds for, in a nonprofit setting. You know, I have a sister who's an attorney, and I wanted her to write up a trust agreement and start trying to, you know, raise funds for one or two people to partner with one of the local dentists around here, or in another area nationally, to do some free or sliding scale work, and allow a deserving patient to have dental reconstruction. And I really feel strongly that a calling to do that. So hopefully after I get my own teeth taken care of and figure out how I'm going to raise funds more effectively, then I will be able to do that for someone else. And that's something I just really feel would be an enriching experience for me. But one of the things that most people do not go through is the situation that I'm going through, and that's, you know, having no teeth. Because most dentists and prosthodontists are able, even with patients that have gross infections and active infection, to pull out the teeth, give the patient antibiotics, and make them an immediate pair of temporary dentures. And those immediate temporary dentures, you know, help the patient acclimate to the denture. It helps the patient with healing and swelling, which I had a lot of because I didn't have that. It kind of acts like as a compression unit for the swelling, so that the mouth really just can't get carried away. And, you know, my mouth went nuts, and so I'm telling you, without them, it can be really quite dramatic. And so, and the doctor is able to make those immediate dentures, because when you first go to see the doctor for the evaluation, they will take impressions of your mouth with your teeth still there. And they make your immediate dentures based on that model, that or mock-up of your teeth and bite. And so immediate dentures are meant to really provide you with something in your mouth, dentures and teeth, for anywhere from 6 months to a year, and some people are lucky enough to get a year and a half, but I really don't know too many people that do, because the tissue here and here, the bone tissue, without any roots in the teeth or implants in the teeth, the bone tissue rapidly disintegrates, and the gum tissue also, just shrinks down right along with the bone. And one of the advantages of having implants placed later is that with the implant placed into the maxilla or the mandible, your body is able to recognize that as kind of a scaffolding for growing new bone, and it can grow bone around those implants. And so some doctors are able to place implants directly at the time of extraction. So your prosthodontist will make a plan specifically for you, and it will depend on your overall health. It will depend on the state of decay and the infection in your teeth, and it will depend on cost and how much you have to spend. We, couldn't even afford to pay for the extractions. And we asked my prosthodontist straightforwardly, can you help us? We can't afford this. He is a very well-trained professional. His name's Roger A. Lawton, and he works he owns a practice called the Northwest Center for Prosthodontics in Olympia, Washington. And he is a fantastic, well-trained professional. And when you go to the best, you pay for the best. And when you don't have an insurance to help, it's expensive. Now, that's not to say that Dr. Lawton is charging me more than he should. He's not. But my dentures are going to cost about $6,500 for both the top and the bottom. And then maybe 6 months to a year after that, I will have a total realignment where they'll remake all of the gum tissue, pull all the teeth out of the dentures, and then realign them. And that he does that and doesn't do an immediate denture. A lot of prosthodontists don't. They make you a highest quality, low profile denture from the very beginning, and then 6 months to a year later they charge you anywhere from $800 to $1,250 per plate to do a realignment. And it's not just a sissy realignment where they're just kind of shaving off this or shaving off that or putting in a small pad. They literally are remaking the entire denture, or the soft, the palate portion of the denture, upper and lower. The teeth, are the same. And so that's expensive. It's like redoing the dentures. But what it does do is it eliminates the process of purchasing 2 sets of teeth. Now there are places like Affordable Dentures or Delta Dental, if you have them in your area, where they will give you like a package price where you can have all of your extractions done, you can have immediate dentures made, and you can have a nice set of, kind of moderate. Their highest level denture would probably fall within the kind of mid to lower end of the national average for moderate dentures. And a lot of people are very happy with that. We do have an Affordable Dentures here in the state of Washington, a couple of them. I live out on the northern coast of Washington, and believe me, it's no short drive to go to the only one that's here. I think that's in Tacoma or Puyallup. That would be about a 3.5-hour drive each way. Even Olympia, where I'm seen, is about a 2-hour drive each way. And for me, the ride in the car is just horrific, so it wasn't something I wanted to do. And this particular Affordable Dentures I had heard lots of bad things about, and because of the damage to my face, the traumatic nature of my injury and all of the mitigating health problems, I wanted to see a specialist that could take care of me appropriately. As well as I, worked a career in medicine, and I feel most comfortable with a professional that's had a high degree of training. And you may feel that way too. I would say, even after having a complication with one of my extractions and ending up in the hospital and going through that, I still feel like I'm in the best of hands. My doctor was there for me, and, you're paying for that, and it's worth it. So for me, I would normally have had my dentures made just like anyone else right when their extractions were done, but they wouldn't have been the temporary pair that you only wear for a year. Prosthodontists often do their permanent pair, as I said, and then they remake the dentures 6 months to a year later, and that costs you another $1,000 for each plate, but it eliminates the cost of buying 2 sets, a temporary set and your permanent set. And many people complain about the fit, the quality, the look, the bulk of temporary immediate dentures. But it's better than nothing. I have nothing, and it's excruciating for one thing. It hurts my jaw because my jaw can overextend and close too much.